It's Christine Sorensen reporting from home, and with 3 kids doing school from home right now in my house, I know that parents are being pushed to their limit, kids and teens are being pushed to their limit, and mental health is of utmost importance. And in my Kidsburgh report today, we're talking with Dr. Abigail Schlesinger, Chief of Behavioral Science at UPMC Children's Hospital. And Dr. Schlesinger, I know when we talk about mental health of kids and teens, you said we really can't talk about that without also addressing the mental health of the adults and caregivers. Why is that?
First of all, one of the best predictors of a child's mental health is having at least one strong supportive parent in their lives. I know that sounds obvious, right? Kids come with parents, but when times get stressful, it's really important for us as parents to back up and realize that we need to take care of them ourselves. And that's for a couple different reasons, not just because we need to be healthy to take care of our children, but our children watch us, they learn from us. Even our teenagers watch us and learn from us. So they're watching how we respond to this as much as we want to help support them.
What other signs might indicate that a child or a teenager is really to the point of stress that they need to talk to a professional and not just a parent?
Right. So, at the end of the day, it's always how well they're able to sort of do the things they need to do, which is harder to gauge these days, right? Because our expectations have changed.
Yeah.
All of a sudden, mom or dad are educating their child, and maybe they never had to do that before. So there may be more irritability, more anger, more frustration with ourselves than we've seen in the past. But we should be able to push through that. The other thing is children are more likely to have stomach aches, headaches, aches and pains. Even adults can have them when they're anxious and depressed, but children are even more likely to have those and not connect them to an emotion. Sometimes we want to help our children never be upset, to always feel good, and that's not actually a reasonable expectation in life. In fact, if there's anything we've learned from this experience, is that emotions and stress is a part of life, and you need to be resilient. You really need to be able to express those and experience them without breaking down.
Dr. Abigail Schlesinger from UPMC Children's Hospital, thank you so much. And you can get a lot more information about mental health resources at kdka.com/Kidsburgh. We'll link you to the kidsburgh.org website where you can find all kinds of great information for kids and families during this coronavirus pandemic. I'm Christine Sorensen.